Hello and welcome to Mother Tongue, the podcast where modern motherhood meets real life. I'm Marianne, founder, podcast host, and mum of three, and I created this space for all the mums who are juggling it all. From toddlers and tantrums to businesses and burnout, we're talking about what it actually takes to build a life, a career, and a family all at once. Here, you'll hear honest, unfiltered conversations with founders, freelancers, experts, and everyday mums about work, wellness, identity, mental health, relationships, and everything we carry that no one talks about. Hit follow, join our community, We Are Mother Tongue, and tune in for real talk that supports the whole you, because modern motherhood is busy and no one should do it all alone.
We are so incredibly excited to welcome Dr. Charles Bain to Mother Tongue.
I'm really well. Thanks so much for having me.
Am I calling you Dr. Charles or Dr. Bain? What should I go back?
Well, you know, in the UK it's Mr., so you can call me Dr. Charles.
Dr. Charles, all Charles.
I've taken on the mantle of the doctor here.
Well, do you know, I actually feel like I'm insulting people if they are supposed to have a doctor in front of their name and I don't say it. Do you not?
Whatever you come for.
Anyway, before we get into all the details today, can you please start with telling everybody a little bit about yourself and what you do?
Sure. So I'm a consultant plastic, reconstructive and cosmetic surgeon, and I work at Mediclinic Parkview. I've been a consultant for around 8 years, and I was in London as a consultant in central London for 5 years before coming out here for family reasons. And yeah, I have a varied practice. So like many plastic surgeons, I have a reconstructive practice, and also I have a subspecialty interest in cosmetic surgery, particularly of the breast and body, which is what I'm here.
The mummy makeover. Now, I wanted to ask, and I'm guessing your role here is possibly quite different to what you would have been doing in the UK with the NHS, but have you always seen people who are coming in for aesthetic reasons, or are there other reasons that people come in?
No, so I think in the UK as well, you have a mixed practice.
Yeah.
The NHS did the reconstructive, and then I was working privately in Harley Street and cosmetic stuff. Whereas here, the difference is because you're in a private hospital, it's all under one roof. Yeah. So sometimes patients come into my clinic for reconstructive surgery, and a lot of them come for cosmetic surgery, the mummy maker.
Reconstructive is more if you need it for a medical reason, is that correct?
So no, that's a really good question because there is a lot of overlap. Reconstruction can be after trauma or cancer. Yeah. But also, aesthetic surgery often has a reconstructive element to it.
Yeah.
So there's a huge amount of overlap. So for instance, if you're doing a tummy tuck after someone has had a baby, then the abdominal wall might be weak, and we repair the abdominal wall as part of the tummy tuck. So it has a functional aspect to it, and that's a really important part of cosmetic surgery.
Okay, so I have a friend actually who she went in for a tummy tuck because her diastasis was so terrible. Now I'm going to ask this question for all the people out there. Just like bringing your abs back together, is that something that insurance covers?
The question.
Generally intrigued.
The problem with the diastasis recti is that it is separation of the six-pack muscles, but it's not a true hernia. The thing that insurance covers is a hernia repair.
Okay.
So if you have a hernia in addition to your diastasis recti, then you can have that covered as part of your tummy tuck procedure, but there will always be a surplus to pay for the cosmetic part of the operation. So it can be possible to get a mix, cover and not cover. So that's certainly something to come and talk to me about, Andrew, because it may be something we can sort out.
So the mummy makeover. I think most people do know what a mummy makeover is now, because I feel like the buzzword, the term, is used a lot, especially now in kind of modern motherhood. But for those who don't know, what is included in the typical mummy makeover?
So essentially a mummy makeover is a combination usually of breast surgery, be that breast lift, mastopexy, breast augmentation, combination of two, or sometimes breast reduction, plus usually an abdominal procedure, which is a tummy tuck with or without muscle repair. So that is the combination. However, it can also be whatever other parts of the body are troubling you. And I guess it's usually used only for women who are postpartum, but of course women who have lost weight for other reasons or had body change for other reasons can benefit from procedures. So I think it's not the best term, but everyone knows it. So I think we should use it, but just understand that it's not just for postpartum.
Yeah. I'm going to jump the gun a little bit here before we come back round. Do you think with the rise of things like Mounjaro and Ozempic that you're going to see a lot more women coming through your clinic to have tummy tucks for skin reduction because the weight loss has been so dramatic?
Yeah, I think so. We used to see a population of massive weight loss patients who had lost huge amounts of weight, usually from gastric bypass or quite significant bariatric surgery, balloons, exactly. And that population is dropping off slowly because people aren't tending to get to the super obese stage. So they're not needing the massive procedures. The Mounjaro is hopefully going to reduce that group of patients for their own sakes. They don't have this huge morbidity that's associated with massive weight gain. And I think that that group of patients lose weight a little bit earlier and they lose it a bit more smoothly than the massive weight loss.
Yes.
So there will be some contractility of the tissues. So there'll be some elastic recoil. So perhaps we won't see these people with massive hanging folds of skin like we did with the massive weight loss patient. But still, the weight change is one of the reasons that ladies come to see me. Yes. So after Mounjaro, after a real period of diet and exercise, you know, or after the weight loss associated with having gone through childbirth, you know, those are the patients that sometimes things don't snap back. And
and I'll come back around to that. But what is your general opinion? I'm so intrigued to know on things like Mounjaro and Ozempic, because I feel like, I mean, I haven't spoken to a lot of medical professionals about this, but the general consensus is people either are seeing massive pluses to it and other people are quite negative about it. But I did read a very interesting article, I think it was in the Times, about how the rise in these drugs is going to help the environment because, for example, less fat people are going to be going on planes, so they're going to need less fuel and the impact that that will have on the environment. Was blood.
Yes, that's my line. I think, I think it's an amazing thing. I think it's a game changer. I think I'm no endocrinologist, and so I can comment, but I would not take it as medical advice. But I would say that for a group of people, it will be fantastic. And I think we'll see a lot of improvement in cardiac problems, diabetes, all the things that are associated with obesity, because people will be offered this instead of getting to that point. But I think that there need to be some caveats around and it should be prescribed by a doctor rather than got off the internet, because there are things like muscle mass loss. You need to watch what your diet's like if you're having this. So it's not a cure all. It's a great thing.
And I think if it's regulated in the right way, it could be life changing to future generations, which is very interesting. So mummy makeovers, I mean, this is something that it crosses my mind all the time. And as I mentioned to you off air, I had a lift and
Yes.
Yeah, thank you. After my daughter. So I have 3 kids. My daughter is the middle one, just for context. I have been one of those women who has suffered extreme weight gain through every single pregnancy. I mean, we're talking like 30 kilos plus every single time. And that is quite drastic for a body to go through.
Cool.
I was quite nervous about getting my boobs done. I was nervous about the general anesthetics. You always hear the horror stories. You don't really know what the outcome is going to be. But just for people who feel like that, like how common practice are these procedures that you're doing now? Like what are the concerns? What are the risks involved? Because it's very different to what it was 30 years ago.
Yeah, so I think there's a few things to think about when you're considering where to get it done and who to get it done by. I think that sort of perhaps is a way to frame it. Every surgical procedure that one could consider will have a list and a set of risks attached to it. And there are general risks of having an anesthetic. There are risks of the procedures themselves. And of course, if you're talking about mummy makeovers in the truest sense of the phrase, you're talking about combined procedures, which again is more than one body area, which prolongs surgical time. So you've got to be fit to undergo that surgery.
Okay.
And you've got to be in the best shape you can be in, so the recovery is as good as it can be.
Okay.
And I think if you're in that condition, so your body mass index is in the range of ideally under 30, ideally under 28, as close to normal as it can be, and you're healthy and you're psychologically well, that's really important. And you have realistic expectations, which is part of my job, then I think it can be really good. But also if we're talking about in the postpartum woman, so after having childbirth, then there's a period that you should let elapse before you have it done. Yeah. So I think if you're breastfeeding, for instance, if you are still under the influence of the hormones that follow childbirth, really you need 6 to 12 months for things to stabilize before you think about having it done. And of course, you mentioned you had it after your second pregnancy, but usually we say wait until your family's few please.
Yes.
So,
wise
surgery, so that the aesthetic result is maintained as well as possible.
Yeah. I agree with that. I definitely wouldn't advise having your boobs. To be fair, they have come out the other side quite well, but it did, there was a lot of if buts and maybe on if you can breastfeed, and actually it was fine. I was quite surprised because, again, I clearly haven't researched the procedure that well, but I thought everything had been cut. So you said 6 to 12 months you should wait postpartum. And again, you mentioned being in good physical shape. Would you advise, if people have a bit of weight to lose, would you advise them trying to lose a little bit of weight before going through the surgery and maybe getting your lifestyle and diet under control before going through it?
Yes, I mean, I think it's always easier said than done, isn't it?
True.
Especially in that period after having a baby, or but I think yes, you need to optimize as best you can, and really that means weight stability and being close to what you see as an ideal body weight for you. And it makes the surgery easier.
Yeah.
It makes the aesthetic outcome better. So it's in everybody's interest. Tummy, and you're removing just skin and repairing muscle, then the aesthetic outcome there will be more predictable than if there's more fat under the skin involved as well. So definitely as best you can.
If you're doing a tummy tuck, would you always say that you need to have lipo to accompany the tummy tuck? Do the two go hand in hand? Do you ever do a tummy tuck without lipo?
So in the vast majority of ladies, the tummy tuck involves some liposuction. So it's called a lipoabdominoplasty, and that's usually the gold standard. But there is a small subset, and it's quite a small subset of ladies that have really toned tummies. They've lost all weight, and it's literally just skin. Not that many, but it's possible. And no fat in the flanks or anything like that, so you don't need to sculpt it at all. Those women don't need liposuction.
Talk to me about lipo, because, again, I talk about this a lot. It's clearly on my mind. Again, lipo is horrendous. And again, from kind of my parents' generation, I remember when I told my parents that I was going to get my boobs done, I mean, they were literally like, you might die. It's so dangerous. I was like, right, okay, so we're living in a different century here. But when I was growing up, there were horror stories about liposuction in particular. What is liposuction like nowadays? Should we be concerned if we're getting liposuction?
So I think the other thing I forgot to mention is when you're choosing a surgeon, you need to choose someone that's board certified. And that's the procedure that you're doing, because then you're more likely to get someone that's going to do it safely. And they should be in a safe facility where there's proper standards, checks. And if something does, God forbid, go wrong, you could be taken care of in that facility rather than having to be shipped out to another hospital.
Yes.
So that's where, why I think the baseline mat is a great option, because it's got everything on site. In terms of liposuction, there are ways to make it safer. So nothing's without risk, but for instance, you should only take a certain amount of fat in terms of the volume in liters away, because we know that taking large amounts of fat in one sitting can cause fluid shifts, which are more likely to give you problems. And of course, if someone expert is doing it, they're not going to give you the really bad complications, which are injuring, internal structures with the liposuction cannula, which should really not happen. But those are the sorts of horror stories we hear. And if it's done properly in the right layer of the fat, then that won't happen. So it's all about having someone that's properly qualified in a safe facility and doing it with sensible limits.
And am I right in thinking that the lipo probably takes a little bit more time from a recovery standpoint than your normal tummy tuck?
Yeah, I think you feel a bit beaten up. But you feel a bit bruised and a bit battered. I think the thing that really adds a bit of time to the recovery is the muscle repair. So, because that gives you a slightly longer recovery. You feel a little bit tight and a little bit, often ladies are a bit bent over for a couple of weeks, and they gradually straighten as they adjust. Liposuction, you feel a bit bruised and battered, but it's not a massive change if it's done within reason.
I'm going to come back to actually about picking the doctor, because that is very important. And especially here, I feel like when people talk about all the different procedures that you can do from a cosmetic standpoint, doctors are known, they are becoming more known for certain areas. I just don't think, I mean, again, you're in this field, so correct me if I'm wrong, but I don't think there are people out there who are experts in absolutely everything. I think people have a preference. People do more of a certain surgery. Is that right?
Yeah, and I think that's as it should be.
Yeah, agreed.
I think it does depend a little bit on the surgeon. There are some surgeons who, for instance, only do cosmetic surgery, and they may be able to offer many procedures. But the vast majority now do subspecialize and try and optimize their skill set in one area. So you find a plastic surgeon who concentrates on the face, or often the rhinoplasty surgeons just do rhinoplasty. And in my case, my interest is in breast and body surgery. So that's my specialist interest area.
And then talking about kind of the start of the journey. So let's say Sammy, my lovely videographer sitting over here at the moment. She is like, I feel like I want to do something. I'm not exactly sure what I need to do or if I should do it all at the same time. How does the process go? Do people come to you and say, if you were me, what would you do? Or do people normally come with an idea of what they want?
I think the patient these days, or the client, is usually very well informed. But often they're coming to you with a preformed idea of what they want. And I think so it's unusual for them to come and give you a carte blanche and say, what do you think? But it's not impossible. But often they'll have a particular body area that they particularly don't like.
Yes.
So it's that body area. They may not know what they want done, but they know it's that area they don't like. And that's a good starting point. And so the way it works is, a lady will come into my clinic and we'll have a discussion. And that's the first thing. And it's about building a rapport, finding out what her aesthetic goals are. And of course, I've got to take a full history. So know all about your medical history, whether you've had any surgeries before, because that's all about making sure it's going to be safe.
Yes.
What we're talking about. Safety is paramount, is the first consideration. So there will be very occasionally that it's not appropriate to do the surgery the patient wants because of other medical. That's unusual. So and then I would do an examination, and we always have a nurse there just to make the patient feel comfortable, and sometimes take some photographs, which are anonymized, but it's just so that we can look at the photographs together and talk about what we're both seeing, because sometimes there's a bit of difference, what the patient sees and what I see.
Okay.
And then we talk about plan of potentially addressing what problems are. And that is a plan that the patient then goes away and thinks about. I often send them some information leaflets and give them some things to think about. And then there's always a second consultation.
Okay.
Because you want to be 100% sure that you're both singing from the same hymn sheet, as it were, and both have the same aesthetic goal in mind. And that's usually firmed up at that second appointment. I think that everyone really should have two consults before having surgery. And of course, if the patient wants more, then of course we can chat more. And that's how it goes. And then there's a pre-assessment process. So the patient will go and meet the anaesthetist, check everything's safe from that point of view.
Great.
And that's all included as part of the process.
And then kind of from the start of that process to op day, what is the normal timeline?
So it depends. There are busy times of the year and there are less busy times of the year. So it depends on what my waiting list is and theatre availability. But usually for that 2 consult period, you want to give the patient some time to think. And they must then feel pressured. And they must always be sure that is what they want to do. So there's never any pressure from our side. Sometimes the patients want to then have it done yesterday.
Yeah, I was about to say, I mean, like if someone wants to turn around and be having an up 2 weeks later, is that typically something that happens, or are we talking months?
There's usually a bit more of a waiting list than that.
Okay.
Hopefully not months. We can usually facilitate, in my practice, kind of getting people in a good time frame.
I want to come on to sizing. I honestly, when I went to have mine done, I didn't have an idea of how big or small I wanted to go. Kind of went with what the doctor suggested, which worked really well for me. I mean, obviously you see people the entire time, really what looks good on certain body types, certain heights. Do you normally advise women on breast sizes or reductions, or do you find that people normally come and they're like, I want them to be massive? And if someone did come and say, I want them to be massive, and that probably wasn't right for their body type, would you advise them otherwise? Or
I think so, yes. I mean, that's my role. And actually, those guys don't often come to me. They often come and say, I want to have enlargement, but I want it to look natural in keeping with my body shape.
Yeah.
Just enhanced.
Yes.
And there's a number of parameters we think about. So part of it is the measurements of the breast. So it's about base width of the breast, how wide the chest is, and that will help determine how much volume we can get in.
Okay.
As part of it, what the skin envelope's like, how expandable it is, and that's often partly how big your breasts were before childbirth, for instance, if we're talking about postpartum women. And then we talk about implant shape as well, because some ladies like a fuller upper pole of breast. So that's often a round implant, whereas some women like a more teardrop shape, which is a bit more natural looking, less augmented looking. And that will also have an influence on the volume. And there are various ways in which we can kind of communicate to that patient. There are simulators, there are external prostheses they can try on in their sports bra. So there's ways to size it.
Okay, interesting. And in terms of what you normally do for the procedure with boobs, do you go below the muscle, above the muscle, and between the muscle? I know lots of different people do different techniques, but what's common practice nowadays?
Yeah, so I think it really varies. So it's partly about the tissue thickness. So it used to be that when implants used to ripple more, now much more visible, and the technology in the implants was not sound. The vast majority, and certainly my training, we used to go under the muscle and partially under the muscle. But now the implant technology is so good that we have options. So one can go something called subfascial, which is on top of the muscle, but under the fascia on the muscle. And the good thing about that is it doesn't violate pectoralis muscle. So if you're a gym bunny, or generally speaking, you don't get twitch of the pec sitting over the implant, which is called a dynamic deformity. So that's something to consider. So it's not under the muscle for everybody. I don't think that's a good way of doing it for everybody.
Okay.
There will be women for whom that's the best option.
In terms of pre-prep, so we're talking about the week before surgery, what do you normally advise patients to do to kind of prepare for the surgery?
Yeah, I think you just, I think you want to be well hydrated. You want to have good diet. You want to be calm as much as possible. Although there's always a little bit of anxiety before surgery. That's completely normal. And then you want to have support. Family around, someone to be there when you're after in the post-op period, and to be in a good frame. I guess in the week before it's not so important, but you want to be in a good place psychologically coming up to your surgery in the months before.
And after the surgery, again, I don't think I stayed. I think I had my surgery in the morning and my husband picked me up that night. And I actually don't do very well in general anesthetic and was quite sick the whole way home, which was divine. But when people come to you, do they normally stay at Park for you for a night?
So it depends. Certainly after a mummy makeover, so a combination procedure, the advice would be a one night. But there are some procedures where you have the option of having a day case, as it's called, which is either experience or staying for the night. It kind of depends on what you've had done and what the recovery is going to be like.
I believe it's common practice for everyone, right, to have drains post tummy tuck. What about boobs?
So I think it depends on the breast procedure. Okay. And if I put drains in, I don't send people home with drains. So the patients of mine that have drains only have them for one night. And they come out the next morning and the patient goes home without drains.
Is that for both tummy and... Yes. Okay.
It's a consent. That's quite normal, actually. What they help to do is they help to take away that fluid that forms in the first 24 hours. But they shouldn't be left in too long, because that's when you get problems like seromas and fluid collection. In my practice, they all come out day one post-op unless there's some exceptional reason. Okay,
and then what does post-op look like? So drains come out, which, by the way, that's great, because I've heard lots of people have drains in for a week or so. What is kind of the recovery process? What are your thoughts on lymphatic drainage, for example?
I think lymphatic, you're talking about the tummy. Massage maybe the limbs if you're having limb surgery. Brachioplasty or...
Yeah, to basically get rid of the water, flush the water out of the body.
So it's good after a point. I think you need to wait till your wounds are healed.
Yeah.
And just be a bit careful, because the person who's doing it may not know exactly what surgery you've had done. So I've always asked your surgeon when it's safe to start. Mm-hmm. And I think it probably gets you to the same place a little bit quicker, but you'll get to the same place without manual lymphatic drainage as well in most cases. Mm-hmm. So I don't think it's a must. And it's an extra expense, of course. Sure. But it can be a nice thing to get you a little bit less swollen, a little bit more quickly.
And then what other post-op practices are in place?
Yes. The garments again depend on the procedure you've had done. Yeah. So I think if you've had a breast procedure, usual advice is sports bra, front fastening, supportive, not underwired for 6 weeks. Mm-hmm. And that's just for comfort as well as support. The tummy, I tend to ask ladies to wear either Spanx type high knickers or a supportive garment for around 4 to 6 weeks, depending on what they've had done. Okay. And again, it's partly to help things settle, but partly for comfort. And most women quite like the feeling of support that you get, particularly in those first few weeks.
Yeah, I agree. And in terms of like the pain wave, again, I personally found the recovery of breast augmentation quite manageable. I was actually quite surprised. Yeah, I'm sure everyone's experience is different, but the pain never really appears. I took the advice on what the doctor advised on pain medication, followed it to a T, tapered off them probably after the first week. What really threw me was the general anesthetics. I felt flat, like a pancake for a good week.
Yeah.
Quite like just, I mean, not depressed, but very me. I'm quite a bubbly person. Don't like feeling flat.
No. Yeah, I think it's also psychologically you've been through a big thing.
True.
And there can be that feeling afterwards where it's kind of happened. It's a bit, you feel a bit low because you've taken quite a metabolic hit. So that's quite normal. But I think pain relief is so variable. I tend never to really need to give opiate analgesics, so morphine and things like that.
Yeah.
Most women will be able to do quite well with paracetamol and ibuprofen and maybe something a little bit stronger. But it varies from patient to patient as well. And I think some of that's there's a large psychological component to pain. So if you're a bit more anxious, sometimes you feel a bit more pain and someone who's really chilled.
Yeah.
About things. And that's just personality type. But I had a lady the other day who I did a breast reduction on, and I took really large breasts, a kilogram off from both sides.
Well,
and she used paracetamol for 1 day. And
wow.
said she didn't need anything.
Nice.
So you're right. The experience of pain can be very minimal. Or some ladies a bit more for a few days, but most women by week 1 or 2 are not really needing much.
Okay. And then in terms of to see the full effects of your work. Now, again, I remember when I came out of surgery thinking, oh my God, my boobs are huge. I've gone too big. I was so concerned. But obviously, you're very swollen for a while. And it took a couple of weeks for them to settle. And then that's what I was left with. And I was delighted.
Yeah, great.
Is this the same with tummy taps? Like how long does it take for all the swelling to come down for you to actually see the effects of the work that's been done?
Yes, absolutely. Essentially, your wounds take 3 weeks to heal, usually for all 2 to 3 weeks for ladies. So in that time, you're going to have a wound that is dressed and not fully healed. You need to be careful with it. And then once that's finished, it's onto the scar maturation process. So from the scar point of view, scars go on maturing for 12 to 18 months. Whilst most people have a great scarring result within 6 months, it will keep getting better for that period of time. So I think the swelling, similar to your experience with the breast, the swelling in the tissues does not fully disappear for several months. And that's one of the things that lymphatic drainage can help with and the garments can help with. But yeah, I think you see a good early result at around 2 to 3 months.
Yeah.
But you continue to see improvements for up to 6 to 12 months in all parameters.
And then what about children, mums who have kids at home? What is the protocol around holding them, lifting them, playing with them for both breast augmentation and tummy tuck, like full mommy make?
Yeah, I think if you haven't had the muscle repair, then obviously you don't want to take any knocks to the area, but as soon as your wounds are healed, then you're okay to lift. If you've had a muscle repair, then the muscle repair is only as strong as the sutures for about 3 months. Okay. And then scar and tissue takes over, and that's when you can restart exercising and lifting heavy stuff. So it's a period of recovery, but you can introduce lighter stuff from the 2 month period. It depends how big your kids are.
Yeah, true. Scar recovery, I want to come on to next. Yes, again, I find this quite fascinating, and again, I'm quite happy with my scars. They have faded. I mean, over the years, they really have faded quite a lot now. I remember probably 8 months post-surgery, I kept on getting pain in my back. And I couldn't for the life of me figure out, I had all the massages, the sports massages, people look at it and I was like, this is really weird, where's this coming from? Turns out I went to see a scar physio or someone who is a physio who works a lot with scars. And my scar was tight and it was pulling on my back, which I thought was amazing. How can we best support scar recovery to stop things like that happening?
So there are a few central tenets of scar management. I think first is time, and that's the most important one. And we've talked about that already. So 12 to 18 months, scars can get better. It's just being a little bit patient and allowing for that. Another one is massage. So massage really helps scars, and moisture as well. So scar ointments are good because they keep moisture next to the scar for longer than the simple creams. Massage combined with moisture is a good thing. And the other thing, the fourth tenet, is sun protection. So most areas that you've had mummy makeover aren't going to be exposed to the sun. But
True.
if it's on your face or something like that, sun protection to stop it hyperpigmenting.
And with the mummy makeover, with the tummy tuck element especially, how big are we talking for the scar?
Hip to hip.
Always. Has to be.
Vast majority. Otherwise, you can't do a proper job. So there's often a talk about mini tummy tucks. They still tend to be the same scar. They just move the tissues less, and are usually only appropriate for a very small subsection of women. So the vast majority of women will need a full hip to hip scar. Yes.
I'm going to get personal now, because I mean, you're here.
Yeah.
So I'm 3 kids in. To be honest, last time round, after my second, I thought I would need some work on my stomach with the loose skin. And I have loose skin, but I work very hard in the gym. And most of the time, if I was standing up straight and not bent over, the skin, it didn't look like there was lots of loose skin. However, I've always had large love handles. I mean, I'm sure everyone knows what a love handle is. For love nor money, I can be like a skinny little beanpole. They will not go. Why is this? And what can I do to get rid of them?
That's a good question. So why is it slightly angry as well? Why is it? No, I can't.
I mean, if they're like, go away.
Yeah, no. So essentially, every person, not just women, has different fat deposition characteristics.
Right.
So some women and men, if they gain fat, it'll be in their face. Some it will be on their bottom. Some it will be around their hips and the love handle area. Everybody's different. So part of it will be what your genetic predisposition is for fat deposition. We do see people who are otherwise slim with, resistant annoying areas of fat they just can't get rid of. And that's very normal. But obviously you need to be fully examined and assessed. Sometimes liposuction to an area like that in isolation can do a good job. It very much needs to be, as part of a proper examination, taken in context of what's happening with the rest of the tummy. But that's, yes.
I mean, look, one side of my family, they passed on certain genetic traits to most of the Haggises. It's unfair. One is large calves, like abnormally large calves.
Okay.
I've never been able to wear ring boots in my life. It doesn't matter how skinny or fat I am. Wedding boots aren't getting in my legs. And love handles. We've all got big, love handles at the side and these large calves. It's not a good look. And I mean, the calves I can get over, but the love handles, God, I'd quite like to go. I'm not sure calf surgery is a thing.
If it's muscle, that's a good thing.
No, it's not. I don't even know what it is. Yeah. It's soft, but it's definitely not. We'll just say that. Okay, moving on to stigma around cosmetic surgery.
Yeah.
I do think, look, social media is a blessing and a curse. In a way, I feel like social media has opened up the conversation for cosmetic surgery so much more. For example, again, another thing from my youth, facelifts. I mean, God, if I ever spoke to my mum about facelifts, she'd be like, you can never do that and we'll die. But I've seen quite a lot of women in their late 40s, maybe early 50s who have had facelifts recently and look fantastic. Caroline Stanbury is one of them. And bloody hell, she looks unbelievable. Kris Jenner, I mean, wow. Yes. So the stigma around cosmetic surgery, what do you say to that? We need to stop it, really, don't we?
Well, I don't think it should be stigmatized. I think one of the problems with social media is it feeds a slightly dysmorphic ideal, which is not healthy. Right. So I think that, and there are people out there trying to sort of redress that by putting normal people, normal women, normal shapes online. But a lot of the stuff that you will scroll through is people looking perfect. Probably use filters and all kinds of things. So that's not a healthy thing about social media. I think if social media is used responsibly, for instance, my own social media is about educating, it's appropriate, and it's debunking myths. Then that's a good thing. But we've got to be careful about what we consume and, making sure that there's a balanced view, which is part of the reason for having a consult. To sort of get a sensible opinion.
And to the mums who are curious, but nervous or scared or worried about what other people will think about the possibility of mummy makeover, what would you say to that?
Well, I think good cosmetic surgery should not be something that people look at you and say, you've had cosmetic surgery. They should look at you and think you're looking great. You look like a better version of yourself, and they shouldn't necessarily be able to pick it from the other side of a room. And that's really what I'm going for with most of my patients.
Yeah.
So I think that sort of stigma shouldn't be there if it's done nicely and appropriately.
It's also probably a question you get quite a lot.
Mm.
For a full package, consultations, op, care at hospital, aftercare, what are we looking at? For
So,
a breast separately, and then my makeover.
So that we are competitive at Mediclinic Parkview. I think because of the facility that you're in, and obviously the surgeons that work there, it's probably at the higher end of cost, but it's certainly competitive. And it will include a bundle of care which will take you right through to recovery. And I think that's the important thing. So a lot of places that sell you cheap surgery elsewhere perhaps don't have that wraparound. Yeah.
Also, cheap surgery, just no.
Yeah, exactly. I hesitate to say a price, mainly because it really depends on what you're having done. Ballpark.
You do-
Yeah, I get. Yeah, so I think it depends on, again, what you're having done. So I think if you're looking at some combination of breast and abdominal surgery, it's going to be upwards of 50K as a starting point, and it could go up to 70, 80K depending on what you're having done, whether implants, what the tummy tuck's like, all that sort of thing.
So definitely.
It's competitive,
For sure.
and actually, it's very competitive compared to what I was charging.
Yeah. I mean, I'm a big fan of lymphatic drainage, and I do it just as a normal part of my self-care. I get quite a lot of water retention, especially during pregnancy. Should have seen my feet; they were really bad. They burst out of Birkenstocks, which was not a good look. The people who I do my lymphatic drainage with, they specialize in post-op. And I mean, they were telling me of some of these doctors that have come on the scene in Abu Dhabi, and what they're charging $200+++. I mean, the scale is quite sliding. You can be paying a lot for this, and I think you don't want to go for someone who's cheap, because again, like when you're being cut open, like, don't skimp. But I think you can do your research and see amazing doctors being incredible facilities and not being.
I think that's it, and I think there is a little bit of there's a temptation for some to charge extremely high prices, and patients will come because they think they're getting the best because they are being charged through the nose, and that's not always the case. So I think check your surgeon's credentials, check their board certified, what their experience is, that they've done subspecialty fellowships in cosmetic surgery, and they've done lots and look at their before and after, excuse me, all of those things, and then you can get and reviews online, get a really good idea of what you're getting into before you get there.
And for people who want to find out more, where can they learn more? Where can they find you? Where can they reach out? Where can they?
Yeah. So first of all, I've got a website.
Great.
Yeah. So it's my name, Charles Bain, with a hyphen, .com. I'm on Instagram at Dr Charles Bain. And of course the Mediclinic website as well. There's more information about cosmetic surgery offering there.
Yes.
And then the rest, it should come in the consult, really.
Yeah.
That's where the most information is imparted.
I'm just curious, are you operating most days now?
Well, essentially, I try and consolidate my operating into 2 days a week, and the rest of the time.
Interesting. And again, just personal curiosity, what do you think is the most rewarding part of your job? What do you like the most? Is it the surgery?
Yeah, I think all surgeons like doing surgery. It's kind of relaxing in a nice way. You can have a bit of music on, you're totally focused, and no one's allowed to bother you.
Yes.
It's great. I can concentrate only in the task in hand, which is actually, I guess, the definition of mindfulness, isn't it?
Yeah.
That's great. And the other thing is happy patients. So it's all about, trying to get the outcome they want. And if they're happy at the end of it and life is improved, functionally and aesthetically, that's a great outcome.
You had to repair a lot of botched jobs in your career.
Yeah. So
you've seen a few.
Yes.
Probably hear the word.
Well, I think that would probably be unprofessional. But yes, if you're a plastic surgeon and you're properly trained in a respectable place, then you'll get patients coming from elsewhere who perhaps haven't had such good work done. And of course, try and look after them, but that can be difficult. So I think the main thing is make sure you get it, choose the right person first time.
Do your research.
You may get a deal flying overseas, but that deal will probably not include.
I agree with that. You've been fantastic. Thank
Thank you
you.
so much.
I know where I'm going to be coming post-summer. Deal with the love handles, maybe not calves, but thank you very much.
Exactly.
Hopefully we'll be having more of these conversations.